put my own personal effort in just trying to ensure that our children can learn. But it's not something, Madam Speaker, that we can continue much longer. So, Madam Speaker, you may recall that in allowing a phased resumption of face-to-face classes, we had first considered our infants. As you are aware, our brain builder centers and our infant basic schools have been permitted to include face-to-face learning opportunities while observing the COVID-19 protocols. So some of our basic schools and our infant schools and our brain builders, they have been returning to school. Not all of them, but the Ministry of Education has its process and they are slowly going back out to school. For secondary schools, so in addition to the infant schools and the brain builder centers, we had already indicated to our secondary schools that once the national average of 65% vaccination is reached at the individual school, the vaccinated students would be allowed to be in the face-to-face environment, while unvaccinated students would continue to access their education using any or all of the other modalities, online, audiovisual, or the learning kits. I did take note of the opposition spokesperson's position on the unvaccinated not being allowed to attend school, and I considered it seriously. We've actually asked for some opinions on it, and I've asked the Ministry of Health to provide us with the scientific and technical basis on which you could make these kinds of differential treatment. And I'm assured, and I personally am satisfied, otherwise I wouldn't proceed, that there is a legal and scientific basis for the protection of personal and public health, that the vaccinated and the unvaccinated can be treated with some difference. But still, provisions must be made for the unvaccinated to get their opportunity for education. So it is not about depriving anyone of education. It is about protecting public health. And of course, if you want to get the face-to-face, then you just simply get vaccinated. In the meantime, to ensure that our secondary level students are prepared for their external exams, we have granted permission for the grades 11 to 13 students to be engaged in limited face-to-face activities to include preparation and completion of labs and practical assignments and all activities attendant to the registration for their external examinations. These will be done in small groups using a rotation schedule as guided by the COVID-19 protocols. Madam Speaker, these activities are time-bound and had to be allowed. Madam Speaker, we would not want our children to once again be deprived of the opportunity to sit their exams in a full and comprehensive way. I mean, granted, we have had to make an abridged version of our examinations, but we can't continue with that, Madam Speaker. We just can't. So yes, there is a risk of allowing the children back to school. So we are allowing our infant schools, basic schools, and brain builder centers to reopen unvaccinated. So there's no vaccines for them, right? But where there are vaccines, then obviously we can return on that basis. And Madam Speaker, the way in which we're looking at our primary school students, we will return some of them to school as well, and we'll explain how that is done. Many of those will go back unvaccinated as well. But, Madam Speaker, all of that is with a risk What wasn't said in the last opening of Madam Speaker, and I stayed away from the conversation when blame was being placed. Why you open up and entertainment cause numbers to rise when all those accusations were being made? The full picture was not considered. The government didn't just open entertainment. Before that, we had reopened schools. We had allowed students to go back to school. So we have always said that once we do this, we know the numbers are going to increase. So we are doing this knowing, conscious that reopening and sending our children back to school could also cause the numbers to increase. And so what we are doing is trying to manage the risk. What is the risk of our students staying out much longer and the risk of the rise in numbers? There's no perfect and easy solution. So we believe we can manage the risk of outbreak by strategically allowing some children to go back and putting in place a measure that allows vaccinated students where vaccines are accessible. That is also a method of managing the risk of outbreaks. And that is why a member from St. Andrew South West, why we considered what you said very carefully, because we don't want to deprive anyone of their rights, but we believe that there are good reasons for us to proceed along this line. So students will be allowed to go back unvaccinated, but that would be for the population where no vaccine is approved. But for the population where vaccines are approved, obviously we could mitigate the risk of outbreaks by implementing that. So, Madam Speaker, in relation to primary schools, the Ministry of Education will put out information about how schools will be ranked in terms of their risk for returning to face-to-face. We will look at the enrollment of the school's utilization rate, that is the number of students enrolled versus the number of spaces at the school, the number of COVID cases in the respective communities in which the schools are located, access to water for drinking and sanitation purposes, accessibility to technology, meaning internet connection, and the average distance traveled by students in commuting to and from school. So those are the factors that will give the risk profile of the school. Combined, these factors provide a total risk score that the Ministry of Education, Youth and Information has used to objectively determine the level of risk associated with each school and their consideration for approval for the resumption of face-to-face teaching and learning. Using this risk-based approach, 376 of our 759 primary schools will be allowed to return to face-to-face. Of the 376 schools, 191, or approximately 51%, are small primary schools with less than 100 students enrolled. A further breakdown of the 191 small schools show that 171 of the 191 schools are rural, remote schools with students living within close proximity to the school and requiring minimal transportation. Students in rural or remote communities are more affected by lack of internet or low bandwidth issues and are less likely to be consistently on the online platform. It is on this basis that small primary schools are being recommended in this phase of face-to-face resumption. These small primary schools may operate the full cohort daily or on rotation, meaning some students in face-to-face mode and some working remotely and vice versa. Madam Speaker, in all cases, all students of these primary schools must have some face-to-face learning every week. The Ministry of Education also looked at the medium-sized schools, and we have identified a maximum of three streams of classes in each grade level. So, for example, grade 1A, grade 1B, and grade 1C. These schools also have an enrollment of 630 students or less and are occupying 80% or less of their total spaces. There are 185 of these primary schools, and for these schools, the ministry will require a rotation approach in which some students will be in face-to-face mode while others are using the other approaches. For these schools as well, Madam Speaker, the requirement is that all students must have some face-to-face learning every week. Across the 376 schools that will be allowed back into the face-to-face classroom, in this phase, there are 45,390 students and approximately 2,520 teachers. Additionally, these students will have administrative personnel working in these schools will have administrative personnel working in the school environment. All adults, principals, vice principals, teachers, staff, and others are advised to be vaccinated if they have not already done so. We make a special appeal, especially to those who have comorbidities. Get vaccinated. Because you will be working among children who are, some of them, most of them will be unvaccinated and may have the virus and not show any symptoms. In fact, 90% of them will not show symptoms. As adults working in the school environment, and of course parents and caregivers at home, you will need to protect yourselves by getting vaccinated. There are plenty of vaccines available, and there are many sites, as I've shown, where you can get your vaccination. So, Madam Speaker, I just want to be clear, as we cautiously send our children back to school, the probability, the likelihood is that infections will increase. To mitigate against this, to manage this risk, parents, when your children are going to get vaccinated, if you are not already vaccinated, go and get your vax. Teachers, many people feel that teachers have had a wonderful time during the pandemic. The pandemic has also taken a psychological toll on many teachers. I've spoken to teachers in my constituencies and just generally, and they are now frustrated. They really want to go back into the classroom to pursue the profession of their choice. They miss their children, they want to teach. But many of them are hesitant. They are waiting to see that the pandemic will end without them taking the vaccine. But as you go back into the classroom, the best way to protect yourself is to get vaccinated. So, Madam Speaker, the Ministry of Health will, along with the Ministry of Education, they will provide the necessary guidance and monitoring as to how this process will be done. They will be informing the schools shortly. The start date for this, Minister, I see my text here, November 8th. November 8th. Right, so write that down in your diaries, parents. November 8th, that's what we're looking for. If your school qualifies for face-to-face, you will be notified and you will have enough time to get whatever supplies that would be necessary to get your child back into face-to-face. Madam Speaker, as I close, I urge all members of this Honorable House and all well-thinking Jamaicans to come together and do all we can to dispel the misinformation that has taken over the country. Everybody has a right to express your views. But Madam Speaker, the same people who cry freedom of choice, they operate in such a way as to take away the freedom of choice for those who would have ordinarily taken the vaccine by spewing untruths, propagating myths and propaganda and just outright lies about the vaccines, and the unsuspecting, the gullible, the uninformed, they just take it up. And in a low trust society, what else can we expect? But the greatest irony is that some of the very persons who are preaching against the vaccines, they have gone quietly and privately, and they have gotten vaccinated. And you will know by their travels. You will easily know it. So, Madam Speaker, I urge you not to be a victim of the falsehoods that are being spread. So, Madam Speaker, all the vaccines have been proven to be highly effective in preventing severe illness and death. Certainly all the vaccines that we have approved for use in Jamaica. Nearly 7 billion doses of the COVID-19 vaccines have been administered globally. Over 2 billion doses have been administered in China alone. India has passed 1 billion doses already. What more are you waiting on to see? In Jamaica, we have administered just over 900,000 doses. So, Madam Speaker, all the persons who have died from COVID-19 in Jamaica, over 98% were unvaccinated. 99% of the persons hospitalized from COVID-19 are unvaccinated. The evidence is clear. I urge all Jamaicans, put your fear aside. Skepticism is healthy, but if you get COVID-19, you may not recover. Be wise and weigh the risks. Do your part and be a hero in returning Jamaica to normalcy. We want to go back to party again, and we want to see we friend past 10. Yeah. So let's do the right thing and get vaccinated. God bless Jamaica.
Madam Speaker,